Within sleep, breathing and obstructive apnea, there are key definitions and acronyms that you need to know. So let's start with the first one, sleep. Well, let's define it. We all do it, varying quantities and qualities perhaps, but it can be defined as temporary, cyclic, and a physiological loss of consciousness. Readily aroused, can be woken, stimulated to return to normal consciousness. So moving on, obstructive sleep apnea. Now, OSA, this is a condition, it's a breathing disorder made up of repeated interruptions of sleep, made up of what's called apneic episodes. Apneic episodes are a complete cessation of breathing, typically 10 seconds, it can be as much as 2 minutes at a time, and they occur many times during the night, as it says, repetitive interruptions of breathing during sleep. This patient cannot sleep and breathe at the same time. They do one or the other. Everybody, it's important to know, everybody will have some apneic episodes in their sleep, but it's only really of interest when you reach a tipping point and it becomes symptomatic, and that's when we talk about obstructive sleep apnea syndrome. So symptomatic OSA, this is when the sleep disruption is so much that it manifests as hypersomnolence in the day, excessive sleepiness during the normal wake time. OSA causes irresistible sleepiness in unsuitable circumstances. So stereotypically, let's think of a lorry driver. He has poor sleep, obstructive sleep apnea syndrome, and he cannot stay awake. He will have perhaps micro sleeps, but this is not something you can control with caffeine, opening the window, turn the radio up, the typical things. It's irresistible. Do anything in sleep, you will come across the ESS, and then will be talked about an ESS score, an Epworth Sleepiness Scale, and it's a patient-completed, entirely subjective questionnaire. It consists of 8 questions, each one with a scale of 0 to 3. And it's very important to actually look at the answers that the patient has given for each question, because it is subjective, and your sleepy snorer will never admit to, well, it's very unlikely to admit to feeling sleepy when driving, which is one of the questions. So intelligent interpretation is required. The AHI, on the other hand, is an objective assessment or an index of sleep apnea severity. So once the patient's actually undergone some sleep tests, whether it's in a hospital or at home, you will get an AHI. Now that is a figure of, an index, shall we say, of disease severity. Now, it's made up of the apneas and the hypopneas. Hypopneas you can think of as underbreathing or shallow breathing. And the apneas, to define an apnea, it consists of 10 seconds cessation of breathing with a 4% dip or a decrease in blood oxygenation level to qualify as an apneic episode. Now, when we talk about AHI, we're talking about the number of these apneic, hypopneic incidents per hour, not just per night. So it's important then to understand that a mild OSA patient with an AHI of 5 to 15, they have 5 to 15 incidents per hour for mild, 15 to 30 incidents per hour for moderate OSA, and 30 and above for severe obstructive sleep apnea.